right, well, thank you all for coming out, for those who are joining in person. Also, thank you all online who are joining us. So we're going to go ahead and get started so that way I can be mindful of your time and also we can get in as much information as possible. My name is Dr. Deanna Middlebrooks. One of my specialty areas for physical therapy is the pelvic floor. So today we're going to be talking about diastasis recti or diastasis, depending on what part of the country that you're in. So with this itself, we're going to dive into a little bit of information as to what causes it, why we have it, especially as women, especially after having babies, and what we can do about it. And I also do want to offer my apologies because Mr. Cheryl Burrows was supposed to be here with us this morning. She's a mental health specialist, a counselor who is trained in trauma and also trained to working with both pregnant and postpartum women. She has a mommy group, and I was hoping she'd be able to highlight her mommy group is for moms who are just having babies, all the way up to moms whose babies are grown and in college and elsewhere in life as well. But she unfortunately is under the weather and ill, so she is not with us. But if you would like her information because you're needing any type of mental health support, especially the topic that we're going into, please let me know and I can put you in contact with her. The reason why I wanted her out is just because we are going to be talking about something that does directly affect our body image and how we perceive ourselves. So I wanted to make sure, and I still can make sure if you all do need additional services, just to make sure that you get what you need. The biggest thing that I want to make sure that you feel when you leave is educated, informed, and empowered. And if you're not feeling that, then I need to fix something. So please let me know. This is a safe space. I want to make sure that everyone is comfortable. Everyone is comfortable to participate at your own level. So if you don't want to participate, you do not have to. If you want to, please feel free to. Also, at any point in time, if you're feeling uncomfortable, feel free to back off. That's quite all right. Because we are going to be doing some screens if you are willing and if you're able to. We're also going to be talking about different things that you can do to try to help the initiation of improving your diastasis itself. So, any questions before we jump into things? Awesome. Well, like I said, I'm excited y'all are joining. This is going to be a lot of fun. So with diastasis recti, you do have a handout inside of your actual bag itself. And online, you'll be getting this handout via email, so don't feel like you have to take additional notes. But this handout more so is just going to sum up the information that we discussed today and also just give you a bit more education behind the topic. So diastasis recti, what is it? This is actually a normal thing that happens during pregnancy. At time of delivery itself, you can expect for 100% of women, so pretty much every single woman that is going into labor at that moment, they're going to have that separation. Why? Because the baby has to grow. So we do need place for the baby to grow, so it does change our body itself. The linea alba is a thick band of fascia that's right down the center. That thick band of fascia itself is actually what stretches, and in some cases, it does thin out of it. But that thinning is normal as it begins to stretch. So as that begins to stretch, the muscles also begin to widen out. Now everyone knows those lovely six-pack muscles in front. Those are the muscles that are generally most affected. However, you have muscles on the outside, on the lateral side of your body that also need to be able to function properly in order for your diastasis to begin to heal. We tend to forget about those. Everyone just always looks at the six-pack muscles in the front. So as we dive into things, we're going to explain the importance of some of those lateral-based muscles. But first, let me give you some more facts. Like I said, diastasis recti is present in 100% of pregnant women at time of delivery. At 6 weeks postpartum, you have a majority of women who still have the diastasis recti, more than 60%. So that 6 weeks visit when you go see your OB, guess what they're not looking for? They're not looking for that. They're also not looking for your pelvic floor. They're not. The only thing that they're really checking is how is the cervix closing, and is your uterus back. They haven't done anything to assess your muscles, and that is where physical therapy comes into play. It is extremely important that you take the first few weeks slow. Your body itself sometimes can actually require up to 1.5 years after having a baby to recover. So, taking it slow. You should not try to jump back into running, doing a lot of plyometric-based activities too early. Why? That can affect your pelvic floor. That can worsen that diastasis that's naturally already there. So we already said at 6 weeks, 60% of women or more are going to have it. Well, at 6 months, we do have a decrease in women who have it, but you still have a significant number of women. You have close to 40% of women who still have that diastasis. Now, when I say still have it, that means that they've been tested for it, and then they also typically have another issue going on that we've brought our attention to that. But there's a significant other portion of women who don't get tested, who don't know something is going on. So there's still a big group of women that we could be potentially missing that may have that diastasis and also may have pelvic floor dysfunction. And the reason why I keep mentioning your pelvic floor with the diastasis itself is because individuals who have a diastasis recti, that separation, they're more likely to have pelvic floor dysfunction. What does pelvic floor dysfunction look like? It looks like pain with sex. It looks like incontinence. It looks like all of a sudden you're just having spasms. It looks like, when I say incontinence, let me back up, not just urinary incontinence, but also fecal incontinence. A lot of people don't realize that after having a baby, fecal incontinence is very common. Notice I didn't say normal, because normal is not what it is, but it is very common, okay? And the same thing with urinary incontinence. If you go to your doctor and you jump or you sneeze and you pee, and they're like, oh, that's normal, it's not. That is not normal. It's common and normal, two very different things, okay? So please don't be confused. Just because your friend is saying, this happens to me, and you're like, well, it happens to me too, must be normal, it is not. But those types of things with the pelvic floor are very common when your individual does have diastasis recti. Now, the research as far as whether or not it can cause back pain, this is typically a question I get. The research on that is spotty. The reason being is that majority of people in their lifetime have some type of back pain. Because of that, we can't really attribute diastasis recti to causing back pain. However, I will tell you that if you do have a weakness in your core muscles, and not just the muscles here in front, the muscles in the back, and also that pelvic floor, you're more likely going to have back pain. Most of my back pain patients have terrible pelvic floors, so we end up having to work on that as well. So those are just some of the facts for you. Now, before you have a baby, everyone's like, well, how do I know if I'm going to ever get back to normal? Let me go ahead and bring this out there. You may not get back to normal, and that is okay. That is something that we as women are still adapting to, especially in our society now. It's the concept of our body image itself. So we do need to become more comfortable with things do change, myself included. I have 3 kids. So things do change, and we really do need to become more comfortable with that. But even with that being said, I'm not at all saying that you cannot get back to a place to where you are physically and cosmetically pleased with how you look with that aesthetics itself. So there are different things that we can do exercise-wise, but it has to be the proper exercise. Another fact for you, I'm sure you all have heard this, oh, that's not safe for your diastasis. And I don't know, it might be. The reason why I say I don't know it might be is because, are you ready for it? I have some women who are ready for certain activities and others who are not. There's no such thing as a truly safe exercise for your diastasis recti. Your program needs to be individualized. It needs to be targeted just for you. If it is not, then you actually may be doing more harm than good. You could be loading the front side a bit more than what it should be. You also want to make sure you're doing exercises that are specific to the type of diastasis that you have. Because if not, same thing, you could be causing more harm than good by overworking some areas and not targeting the appropriate areas. So where do we begin? First, we're going to begin in just a bit by discussing exactly how do we figure out how we find diastasis. And my people online, I'm going to be sending you all a video as to how to do a self-assessment for this, so that way at home you'll be able to do the same thing here, so that way you can still participate with us. So with that, we're going to look at 3 different areas. With my patients, I typically start off by checking 3 different areas, but as time begins to go on, I'll actually go through and do check a few more, add a few more points in as well. Just because sometimes you may notice that certain muscle groups are not kicking in or firing as well as what you would like. But you're usually going to check above the belly button, below the belly button, and also at the belly button. Each area has different muscles that you want to incorporate when you're looking to try to get someone to heal. You also want to make sure someone can breathe properly. I know the last workshop we talked about breathing. Why? Because most of us don't know how to breathe. In all honesty, a lot of us, we breathe very shallow. We breathe as if we're always in a race, in a fight or flight mode. And that's because, one, we spend a lot of time seated, and also the society that we live in has us, our nervous system is just completely ramped up so high. So we're actually going to start off today by learning how to breathe. And depending on what we notice, if you all are willing to participate with the screening, with your diastasis, that's going to determine exactly what exercises we're going to get you going with first. So first with breathing, everyone, take one hand, put one hand on your chest. Take the other hand, put the other hand on your stomach. And right now, I just want you to take a nice deep breath from me. And I have 2 people who have been trained in breathing, and I know they've been trained in breathing because they're physical therapists as well. So they knew exactly what I was looking for. And they hit it as best as they could. But most people still had the shoulders lift up. Now, if you're in fight or flight, if a lion is chasing you, yes, use whatever you have to use to try to get the air in, please, okay? Use it. But if you're at rest, use your diaphragm. That diaphragm is meant to drop down so that way you can get that full expansion of your lungs. But guess what we do all day? We sit, we type, we do this, driving, eating, we're stuck this way here. Our upper traps are already up here, our ribs are already pulled up, and we don't know how to use that diaphragm. So now we're going to change things a little bit. What I want you first to do for me is first place your just one hand on your stomach. All right, so I want for you to breathe deeply into your stomach. So deep breath in, don't let your shoulders lift up. So deep breath in, breathing into your stomach. Good. Now as you took that deep breath there, what was your jaw doing? Was your jaw clenched? Or did you even notice? All right, so step 2, let's unclench your jaw. So you're still going to use your hand on your stomach. We're still going to take that deep breath. We're going to unclench our jaw. What we're going to do to unclench our jaw, I want you to take the tip of your tongue and place it behind your top 2 front teeth. With that now, take a deep breath from me. No one's shoulders lifted up. Notice the difference. We hold a lot of tension in our jaw and in our shoulders. So now you've gotten 2 steps down. We got the stomach expanding. We still need more expansion than that because we want something called 360 degrees of breathing, which means that you get the full expansion. You get breathing through the front, sides, and back, so all the way around. So now I'm going to have you place your hands here on your side. Just at the rib cage itself. All right, Aaron, relax those shoulders, shake them on down. They don't need, y'all, if you have on earrings, your earrings are cute, please don't make your shoulders earrings, okay? Please don't do it. All right, so you just now, you're still going to allow for the stomach to expand as you breathe. But now what you're also going to do, I want you to feel your ribs lift up as well. So your ribs should actually move out into your hands, and the back itself should move back a little bit as well. Now, if you're really tight in your upper back, you may not notice a lot of movement, and that means we have to get you moving through there a bit as well. All right, so now same thing from me, tip of the tongue at the top of the teeth from me. Shoulders are relaxed, deep breath in. Good. Good. And I actually could see your hands go out and back in. That is how you should be breathing at rest. Now, if I tell you to do that again in an hour, would you be able to remember it? Probably not, okay? The reason being is that it's not something that we consciously think of. So throughout the day, take time, take a few moments just to stop and breathe. And then just an extra bonus tip for you, breathing itself will also help to calm your nervous system, especially during times of stress. So if you're noticing that all of a sudden your anxiety is really high, you're all in a quick panic, or you just have a lot of things going on, stop, take a moment, and breathe, okay? Alrighty, so with the breathing itself, as you can imagine, because your rib cage is moving, you also have the musculature through here that is moving as well. So we want to make sure, that's why I said we're going to start with the breathing. We want to make sure that you know how to breathe. And we also want to make sure when you change positions, you still know how to breathe. Because people are like, oh, I know how to breathe when I'm sitting and standing. I lay them down, things go completely haywire. They can't breathe anymore. Put them on all fours, same thing, they cannot breathe. So as we start changing through different positions, you're going to hear me say, okay, I want you to stop whatever you're doing, just take a moment and focus on your breathing. All right, questions for me so far? No? Okay. All righty, so what we're going to do is first we're going to talk a little bit about how to do a self-screen. And then we're also going, if you're all ready, we're also going to get on the ground with our yoga mats and we're going to do a few self-screens, okay? All right, so before we do the self-screen, I'm going to put this out there. I teach people how to do a self-screen so that way they can monitor their own progress. However, please do not become obsessed with checking yourself. That way you can see where you are. The reason being is because that's anxiety-provoking. You start wondering, what am I doing wrong? And sometimes you're not doing anything wrong. Sometimes it just takes that lovely 4-letter word that none of us like, time, okay? None of us want to hear, oh, this is going to take time, but it takes time and consistency. So don't say, I've been doing this for a week and things aren't getting better. Sometimes it takes a little bit longer than that. And just so you know, for muscles to be able to respond just at the neurological level, usually within the first 6 to 8 weeks is when you start noticing the changes. And that's not necessarily saying the muscle itself is getting stronger. That's just saying your nervous system is learning how to actually properly engage those muscles. So 6 to 8 weeks, that's 2 months. Okay, so just to put it out there, that is 2 months. So first thing that we're going to do, I want you to you're going to utilize 3 fingers when we get on the ground. And the reason why we're going to use 3 fingers is because technically speaking, 2.5 or 2 fingers or less is actually considered to be normal. So we're going to start with 3 fingers. Why? Because if you're already at 3 fingers, we know that you're outside that normal range. And once again, I want to use the term normal with caution because I have patients who have gone from honestly like 6 to 7 fingers now. Yes, 6 to 7 fingers in between. And they're now down to 3 fingers. So that is their new normal. They have no dysfunction, and that is what's most important, is that you do not have dysfunction. So cosmetically, may they still have some of the loose skin? Yes, they still may have some of the loose skin. May they still actually see like a slight gap through here when they're doing activities? Yes, you may. However, what's most important is that you do not have dysfunction. And so if you're not having dysfunction, I'm not going to actually tell you, go see a surgeon. It takes a lot for me to tell you to go see a surgeon with this, especially if you're going to have babies again. So if you're done having babies, that's one thing. If you're continuing to have babies, then it may be an option for you cosmetically. But dysfunctional-wise, that's the main reason why I actually refer to surgeons, okay? Just wanted to put that out there as well. All right, so with the screening, we're going to use 3 fingers. We're going to start first just above the belly button. We're going to have you laying down on your back. And what you're going to do is you're actually just going to lift the head up. Now, if you feel like you're straining, I'm going to allow for you to use the hand to lift the head up. And we're going to see what your muscles do. Your muscles should close in, and you also should feel that linea alba, which is that thick band of fascia, pop up. So if you're not feeling that thick band pop up, believe it or not, that's actually more concerning to me than how wide you are. The depth of that itself tells us a lot more as to how much tension is being generated against that linea alba. So if you have a significant depth with that, that means they got it. We're not getting enough muscle interaction. We also have a lot of laxity in that lining itself. So we need to do a lot to try to help better control that area. So that way you can, 1, get better support, but 2, also be at decreased risk for hernias. Because this is an area where also you can have hernias that occur. Like, have you ever seen the women, I know I was one of them, when they're pregnant, their belly button pops out? That's technically a hernia. That's exactly what that is. So yeah, it's technically, it is not an uncommon thing. It's not an uncommon thing at all. It's technically a hernia, and it's when that the placement of the linea alba itself, typically right at that belly button is where it's the thinnest. So if it's stretching and thinning out, guess what happens? You might get that belly button poking out a little bit. Most women do go back to normal. However, you do have some women who do still have some that do kind of poke out a little bit. Same thing. That's your new normal, and that's okay. That is okay. So we're going to 3 fingers. You're going to gently sit up. We're going to feel that above the belly button. We're going to go down to the belly button. We're going to feel that again, and then going below the belly button. So we're not going to go too far below that area, because once we start getting into the pubic bone region, that's not really telling us as much as far as the closure itself. But what we're going to see is we're going to hopefully see that we get the muscles closing in. If not, we'll see if we can get them closing in, which would be even more fun. And then we'll also see exactly if we can get that linea alba popping up a bit more. Like I said, this takes time. So if we can't get it today, that is okay. The goal is to try to help give you information. That way you know where to progress and how to progress with things. So who's ready to grab their mats? Come on down with your mats. And I did bring one as well, so feel free to utilize that if you like. And we can get everyone on the ground. You're welcome. All right, and online, if you can grab your yoga mat as well, that way you can participate with us.
Do you need me to move the tables back?
All right, so you ladies can come. We can kind of come in a line if you like. Just go right through here. And
Can I borrow yours?
you surely can. Yeah, surely, please.
I can't be not prepared.
No, you're fine. You are fine. Brought one just in case. All right. And I also want to take this time to introduce, this is Dr. Lexi. Dr. Lexi is a physical therapist as well, who specializes in pelvic floor. So she's going to be helping out and doing some screens with us as well, just so we can kind of get an idea and also make her work a little bit. Awesome. All right. So first, I'm going to get everyone laying down on your back with both knees bent. All right. And if you're comfortable, you can lift your shirt up just to the level of the bottom of the bra. If you're not comfortable, that's okay. We can still get what we need to get, okay? All right. So what I'm going to have you do first is find your belly button. So everyone find your belly button. All right. So now that we have found our belly button, you're going to move just above that area. Perfect. All right. I'm going to come around and adjust fingers as well, so that way you can see. Are you okay if I touch your stomach here? Okay. All right. So belly button's right through here. All right, so good. You just placing the fingers right through there. That is your starting point. Perfect. Let me see. Just gonna come right through here. Perfect. Yep, you're right in the right spot. That is your starting point. All right, you got your starting point. I knew you would though. Good. Awesome. So everyone has their starting point. And on the camera here, I'm going to show you. So right now, we're just above the belly button. So we're right through here, okay? Just using your fingers. Like I said, start with 3 fingers, and you're placing it just in the center above the belly button. All right. So now what I'm going to have you do, keeping your fingers there, I want for you to gently lift your head up. Good. And back down. So, what did you feel? Did you feel things close in? Good. Did you feel things close in so that way you only had 2 fingers or less there? No? Okay.
I just felt something come up. I don't
Felt something come up? Okay. No, we'll check. What'd you feel, Colette?
Closing.
Closing? Okay.
I felt closing.
Closing? Awesome. Okay, so I'm gonna come check right over here to see. And now, in addition to feeling closing, did you feel something lift up?
I felt a lift.
You felt the lift? Okay. No lift? Did you feel something lift up and push into you?
Yeah.
Okay. Good. Thumbs up. All right. So we're gonna check over here. Come on, listen. Check right here to see what we feel. All right. So same thing. Just gonna check. I want you to lift the head up for me and back down. All right. Go ahead. Lift the head up and back down. Okay. And lift up. Okay. And back down. Okay.
Okay, I felt the lift part. I didn't know what the close was supposed to feel like.
So you're starting 6 weeks postpartum. Is that bad?
No, you're fine.
Okay.
So this is
Not too good.
no. This is normal.
Okay.
Okay. So this is what I would expect right now.
Oh, I feel
Yeah.
okay.
So no.
It's
Yeah.
good. Okay.
Good.
Perfect.
Yes.
Okay, okay.
You okay? Are you okay with this information? So we do have someone who is recently postpartum with us. So her diastasis right now is definitely a little bit wider. She just had a baby, so that's exactly what I would expect. So she's 6 weeks postpartum. You said tomorrow? Yeah. So hers is definitely a little wider and a little deeper, and that's pretty much what I would expect right now. So that's perfectly fine. And no, it's not too early. So. But most people don't realize that you can actually begin working on this as soon as you have the baby. Breathing. That's what you should be doing. Breathing. Awesome. All right. So now that we have that, so we felt exactly the muscles closing around. We felt some lift up. What I want you to do is now do it one more time for me, and I want you to allow for those fingers to sink in. And let's see how deep your fingers sink in.
Like push down?
Don't push down, but no, so they're just gently sinking in. All right. So what we want to see is less than the first knuckle typically. So typically just the nail bed itself, which lets us know that we have a good amount of tension. However, if you're just recently postpartum, you're going to have more of the fingers sinking in. Okay. Let's see right here. Go ahead and come on up. Good and down. Good. And come on up. Good and down. Getting good tension and also getting good lift as well. So. All right. Go ahead. Let's see. Go ahead. Come up. And down. Okay. Go ahead. Come up again. And down. Okay. All right. So that is our first spot. Now for me, we're actually going to skip towards the belly button area where I want you to go down underneath. Because depending on the location, other diastasis, that will determine what we do. Yep, so same spot down underneath, good. Now you're going to repeat the same thing that you just did. Good, and back down. What did you notice compared to up top?
Not the same.
Not the same? Yep. What'd you notice?
I mean, honestly, my hand didn't really move.
Okay.
So is that
It just depends. So everyone's a little different.
okay?
Everyone's a little different. Let's see. And come up. Good. Okay. Yeah, so you're definitely more open up through here right now.
Okay.
Mm-hmm. Would you notice
Wider.
wider? Okay. Would you notice over here?
I think I'm more open up.
More open up top?
Oh, yes.
Okay. So there are times when women will be more open up top. Other times they'll be more open around the belly button. Other times underneath. And then you have some women who will be open completely all the way through. So what do we do with that? If you're more open up top itself, I need to figure out what's causing most likely your ribs to come out. So I need to figure out what's causing the ribs to come out and help bring the ribs back in. If you're more open at the belly, I need to make sure that one, you're not belly breathing, and two, you're also not ab crunching. So you know how when they tell you stand up straight and every single woman sucks in their gut? So stop. Yeah, stop sucking in the gut. Your stomach should move, but what we don't want you doing is we don't want you holding your breath. We don't want you clenching your abs, because each time you go to clench your abs itself, that's actually going to put more pressure down below and also on that pelvic floor. Which brings me to another wonderful, great fact. How many of y'all have worked out with those waist trainers on? So personally speaking, I am not a fan of waist trainers. Because I want to be unbiased in my explanation, first I'm going to tell you, research actually shows that we're using some type of abdominal binding itself, in addition to corrective exercises for diastasis recti, research does show that it can be beneficial into helping it heal. However, like I said, I'm not a fan of waist trainers, and here is why. Because they actually can cause everything through here to be more compressed, they change the pressure on the inside of your abdominal region. If you change the pressure through here, what you're actually doing is putting more pressure below. So if you're already not breathing well, you're already sucking your stomach in, and now you have a waist trainer, your pelvic floor is probably screaming. So that is why I'm not a fan of waist trainers or abdominal binders. But I also will recognize that for cultural purposes, for the first 6 to 8 weeks, at certain cultures, they do abdominal binding. And because of that, if it's a cultural thing, I step back. There's certain things that I will not interfere with, and that is someone's cultural beliefs and aspects. So if it's something that's cultural based, I'll step back, I'll provide you with the education as far as not having it too tight, just so that we can make sure that you're still able to properly breathe. But if you're using it because it's a new fitness trend, then at that point, I'm gonna ask you, hey, let's ease off of this just a little bit so we can try to get things better firing. But like I said, just so you know, research does support the use of it with core corrective exercises, but that research also does not look at the effect that it has on the pelvic floor. Awesome, all right, so what we're gonna do next, Lexi and I are gonna kind of divide and conquer this a little bit. So first I'll start off over here with Lexi, and then I'm gonna come back over here. What we're gonna do is we're gonna first just try to give you all ideas to where you are starting right now. And based upon where you're starting right now, then we're gonna talk about what you can do, and we're also gonna talk about how breathing can influence this. With that being said, I also want to make sure that you all, when you do this, when we start testing you again, don't hold your breath when you lift your head up. That is essential and that is important, because I can guarantee when I told everyone to lift their head up, I know for a fact everyone held their breath.
I don't even know.
I saw everyone's jaw clench, and I also saw everyone stop moving right through here. So in order to make sure you're breathing, as you lift the head up, now I want you to exhale. The exhale is also important because the exhale will indirectly cue your pelvic floor to kick in. Most of the time, that's what it should do. So if it's not doing that, then we're gonna work on fixing that as well. All right, who's ready? All right, I'm gonna start off over here, and I'm gonna come back over this way. All right, Lexi, so we're gonna come up, we're actually gonna go a little bit higher right through here, so testing through here. Start off with 3, go ahead and exhale as you lift your head on here.
Congrats on the baby.
And
I said, thank you. So the baby was a boy or girl?
Oh,
Oh, my goodness. Is that your first? Your fifth? Oh, my goodness. Girl, you're a professional. You're a professional. I had one and I'm done.
And also get the movement more up so you can.
Imagine there's a lot of work that could be done.
And relax.
I had a cesarean, so and I have been right since. I'm like,
My last, well, since my first four, my girls were all before my boy. The last one was a C-section.
Mhm.
And it was an emergency C-section, so I'm like, all right, I'm ready.
All right, so we're just going around checking, so just be patient with us as we check. So at home, what we are doing is we're doing our self-assessments, we're doing our self-screens. So starting off up top, going down towards the belly button, and also below. Like I said, you'll be getting a video of this, so that way you'll be able to do yours on your own as well. All right, my dear. Exhale, go back down. First up, hold your breath, yeah. Exhale, then lift.
You didn't
It's
either.
okay. Good, and down. Okay. All right. And lift up. And down. Go ahead and lift up. There was something.
It's just a spring out.
All right. Good, and relax. Okay, so most of you right now is through here. And also
Does it have anything to do with if you have, because I have a cesarean, so I have like, I don't know, like weakness in this area?
Great question. Yep, so we had a great question. So can C-sections affect the diastasis recti? Yes and no. The reason why I say yes and no is because if your scar mobility is not moving well, then sometimes you'll develop like something like a shelf, like the skin, and even like the fascia above it will kind of get stuck. So you do want that scar to move well if you've had a C-section. If that scar is not moving well, then yes, it can further contribute to it. Also, we do know that individuals who have C-section, that they typically do cut through a particular nerve called the iliohypogastric nerve, and that nerve does control your transverse abdominis, which is a muscle through here. So there are times when women will actually have a bit more weakness through that area. However, more often than not, what I see following a C-section is that the scar is not moving well. Yeah, if the scar is not moving well, then you pretty much, the skin around it just kind of starts to form and develop, and even the muscles don't begin to respond well. So we typically can get the scar moving better, then long term we can get the diastasis moving better as well. Lexi, I want you to come over, Sean. Start off with 4.